So welcome everybody, and today I have the amazing Dr. Daniel Nightingale, who I trained with and got a diploma through. Now, Dr. Dan, can you explain a little bit more? We just had a little chat before, everybody, so I apologize. And then I remembered to press record. We were talking about the drugs side of the things, and and I always get that there's so many, and you obviously have come across all of these things before, because I heard a lot of these new ones just with Chase Hughes, and you knew about them. So the methylene blue, the nicotine, and the a high dose of melatonin and the glantamine. Can you share with us your wonderful wise knowledge, please?
Good morning, good afternoon, good evening, everyone, wherever you may be in the world. Nice to see you, nice to have you here. So let's just track back to when I first started to practice in the field of dementia. There was nothing. There was absolutely nothing. There was no medication to help. The knowledge of dementia was very minimal. We didn't really realize that the differences between all the different types of dementias, which is, over 100 types. We didn't realize this. So basically what you were doing, we're trying to maintain people's independence with very little knowledge and stuff. So most of the time when people got to a certain point of their disease, they went into a nursing home. In England at the time, these places were called EMI units, which is horrible, awful thing. Start again, put my teeth in. Elderly mentally ill is what EMI stands for. And of course, we know that not everybody with dementia is old, and none of them are mentally ill. So it was an awful label. But that's what we had. That was it. So forward to 2025, and what have we got? Wow, how amazing. We've come so far in such a short space of time. But that's medicine anyway. Everything is speeding up. Everything's rapidly developing. So we know a lot more about dementia now. And the medications, the first medication we had was called Aricept, donepezil. That was the first one that was introduced. And it's what is known as an acetylcholinesterase inhibitor. So just to put that into context, our brain produces acetylcholine. It's a neurochemical that triggers memory. And people with particularly Alzheimer's disease have lower acetylcholine levels. This is why hypnotherapy is so good for people living with dementia, because you get to a certain point in the hypnagogic phase that triggers acetylcholine. So that's one of the benefits of hypnotherapy in dementia. But going back to the medication, Aricept produces or helps to produce acetylcholine by suppressing something called nesterase, which is a nasty chemical that we don't like. From there, we moved on to two other medications, galantamine, rivastigmine, and they are also acetylcholinesterase inhibitors. So now, today, the first drug of choice is usually Aricept, donepezil. Most people can tolerate that. And the job of that is to slow down progression of the disease. It's not a cure. There is no cure as yet. We still have no cure, but it will slow down the progression of the disease for a certain length of time. And then it will stop being effective. And then you may move on to another medication called memantine, Ibixa, which is a little bit different, and it's used for the more progressive dementia, and that works in a different way. So we had those, and that's been around now for quite a number of years. And then we started to see infusion medications, which are called monoclonal antibodies. And this is where people go and have a monthly or a fortnightly infusion of this medicine. And the role of that medicine is to clean up the plaque in the brain. So it will clear the plaque so that people, again, it's not a cure, but it will slow down progression of the disease in a different way. Instead of producing acetylcholine, it cleans up the plaque and tangles, symptomatic with Alzheimer's disease and other types of dementia. And then we've got all these other things that everybody's trying and doing research with and in. And the diet is one of the big things that many neurologists and neurological centres have been really thinking about and working on and focusing on. Recently at Barrow Neurological Institute, one of the neurologists, Dr. Gedder, he ran a trial for 9 months of the mind diet. So the mind diet, is what we always recommend for people with dementia. It's a combination of the Mediterranean diet and the DASH diet. The DASH diet being developed to reduce hypertension, high blood pressure. So we're waiting for the results of that, waiting for his publication to see what happened with that. So diet and nutrition is really big on the agenda in neurology right now. And then we have these other medicines, these non-pharmacological medicines that people are turning to and trying and using. And methylene blue is one that is really coming up onto the scene right now. And we're going to see how that's working. And I've heard anecdotal stories from people who have been using it that are saying they're getting benefit from it. But it's anecdotal. There's nothing empirical that I've seen as yet for methylene blue. Nicotinamide, that's another one. And nicotinamide is something I take with green tea. The chemicals in green tea and nicotinamide work really well together to enhance cognition. I'm 61 very soon. I know, guys. What can I say? I've just got the youthful. I'm a Brit, and us Brits, as you can see with Claudia, we always look bloody good.
You're hilarious.
So I take that, and I have noticed, I've been taking that now I'm into my 2nd month of using nicotinamide and 3 cups of green tea a day. So go for 3 cups.
How do you use the nicotinamide?
It's a supplement, you just take it.
Oh, okay.
One capsule a day.
Okay, 1 capsule. Okay. Yeah. And is that so it's obviously got nicotine in it.
Right.
And then it becomes, because we know it's addictive.
Yeah, that isn't.
But
we've known for years and years and years that nicotine is something that is beneficial in Alzheimer's disease. We've known that for years.
Right.
Ever since I can remember, we've known that nicotine is something that is positive. The rest of the junk. So we don't smoke cigarettes because
that's got the chemicals in it.
That's got the chemicals in it, yeah. So the nicotinamide and the green tea, I found for me, and what we have to remember again is that where brain health is concerned, it's as individual as a fingerprint. If Claudia and I developed Alzheimer's disease today, we would probably deal with it in different ways and it would impact on us differently. Symptoms would be the symptoms, but that doesn't change. But the way that it impacts on us would be different. So it's as individual as a fingerprint. So for me, that's really beneficial for me. I haven't used methylene blue. I don't feel that I need to use methylene blue right now. But what I do I follow the mind diet. I take the nicotinamide and green tea, and I have a beer. I drink beer. I like beer. I have a beer. I like champagne. I have a glass of champagne. That's all fine. You've got to do things. Yeah, exactly. Yeah.
You exercise. You do weights.
I do. Yeah, absolutely. I try and do that 5 times a week. I'm fortunate that here at home I have a gym, so I can just go in there and and work out.
Mhm,
Yeah, and that is another thing that we always recommend. And there's lots of research to demonstrate that strength training,
mhm.
along with your diet and nutrition, is crucial to reducing your risks of developing any kind of neurocognitive or neurological disorder.
Mhm. Okay.
Yeah.
And
So the medications you talked about, I mean, there are many different ones out there that people are talking about and that people are looking into. And I'm always looking at empirical research because you've got something solid that you can look at.
I agree. Yeah, and it's
Yeah.
interesting because I mean I can't diagnose and I can't prescribe.
Right,
I believe you can.
right, right,
So and you're with the Barrow Institute. It's just that what we could do as Lighthouse Brain Health Associates is tell them you could ask your doctor or neurologist, what about this? I've heard about this.
right.
What do you
Yeah,
think? And then it's for them to do it. We can't, but it's nice that we've heard about these drugs and that we are aware of them. I mean, it's yeah. I mean, again, he was talking about methylene blue and peppermint oil and iodine. Have you heard of iodine? Taking iodine
okay. Yeah,
every day because that can help with fatty liver. I mean, there's so
right.
many things.
Yeah, there's lots and lots and lots out there. I mean, coconut oil. I use coconut oil as
Yeah,
well. I
yeah,
take that every morning. Um,
yeah. I
and
often,
there's something olive oil. I always have a shot of olive oil as well, neat in the morning. I don't like it. I don't like doing that, but I know
yeah,
it's good for me, so I do it. So yeah, there's lots of different things, but everything has to. I think it has to be combined. It's like an eclectic approach to stuff, and it's. I don't think one thing on its own works. I think we have to combine exercise, diet, nutrition, mindfulness.
love.
Absolutely, love socialization is another thing, crucial. And we saw during COVID in 2020 that a lot of people were isolated, older people, because they weren't allowed to go anywhere. And
Mhm.
nobody could go and visit their families in nursing homes or memory care communities. So there was a lot of isolation, and people were impacted by it massively. But a positive that I found during COVID was that older people who were living with dementia learned how to use technology because they had no option. If they wanted to talk to their relatives, you got to jump on Skype, Zoom, FaceTime, whatever it might be. Um, and everything at Barrow was shut down, so everything was telemed. So people had to start using this technology, um, and it proved to them that they were able to learn something that they would never have even thought about before. They wouldn't go anywhere near a computer or technology, and they learned themselves that wow, yeah, I can do this. And so some people who I know that went on to develop those skills and learn more about using a computer and stuff like that. So there were some positives that came out of that for
Yeah,
the field of dementia.
it's interesting, isn't it? Because as you say, they had to, and then they had to build those new brain synapses if they wanted to. So yeah,
Right.
yeah. So
Yep.
so it is interesting. And I suppose if they were in a home, then they just became more friendly with each other
Right.
because
Right.
again, they had to.
Yes. No option. Absolutely. Exactly. Yeah. So I think and then doing the brain health stuff, that is, if we're going to lay down new neuronal pathways in the brain, we have to do brain health work every day. We have to challenge our brain. And it it's no good doing something that you're really good at.
Yeah.
That's pointless because the brain is like, yeah, okay. Because your brain's lazy. You know, it'd sleep all day if you let it. So you got to give it something that challenges it. For me, it's numbers, math, accountancy, that kind of stuff. I hate it. I'm rubbish at it. My brain doesn't
Doesn't like
like it.
it.
So yeah, so I started Sudoku. One of my patients actually, who was an accountant, he taught me how to do Sudoku, if that's how you say it, Sudoku.
Yeah, yeah, well, that's how I say it.
Yeah. So so I learned how to do that. And I have another patient right now who is teaching me some magic tricks. So
Yes, yes.
so
It's just
I'm
card tricks, just fun. And when you're doing
yep,
that, you're
yep,
laughing, and it
right.
is. I agree. It's so important. So what you're saying is it's the whole. There's like an umbrella of care of everybody doing, and you can't just do one thing and it will be okay. It's the what you eat, what you drink, it's everything that you put into your body, as well as like getting extra, healthy stuff, trying the nicotinamide, the green tea, coconut oil, turmeric, dark chocolate, blueberries, the extra
Yep,
bits, as well as
that's it.
doing all the brain health exercises. And I've given everybody those things. There's all sorts, getting dressed with your eyes closed and all that sort of stuff, learning new
Yep,
things. Um, and then making sure you socialize
right,
and
right.
exercise. Yeah.
And the same with the husband, the wife, the son, the daughter, the mother, the father, whoever is involved in that journey need to be doing the same thing. Because all these things are beneficial for people who have already got a diagnosis of, say, Alzheimer's. But for the rest of the people that don't have that diagnosis, that aren't on that journey, need to be doing it to reduce their risks of developing.
Yeah.
Because
Yeah.
we know, for example, we know the US is a country of obese people. Obesity is massive here, as is diabetes. And we know that those two things contribute massively. It increases your risks of developing Alzheimer's massively. So we know with type 2 diabetes, if we change our lifestyle, change our diet, we can reverse it. It'll go away. Um, so, doing all these things ourselves, the whole nation, there should be like a policy of this, a government policy rolled out for everybody, like the health of the nation, like we had in the UK a number of years ago. The health of the nation, roll out this policy. I think that'd be a really cool thing to do.
Yeah, I agree. It's like and then encouraging all the family, as you've said, to get involved, even the children,
Yeah, absolutely.
because actually, and then giving the whoever's got the dementia, because they've always got a purpose. They can always and it's about giving them the purpose. But so many children now don't know how to write or do some things or play those simple games. And actually the grandparents, or if they are, because it is usually older people that get it, uh do remember,
Yeah,
and they can teach them those things.
right. Yeah.
um
I
you
think
know
you've got a good point there with like intergenerational stuff. That's another crucial aspect of, supporting people who are living with dementia. Because of course, not everybody's old. We've got a massive increase of people under 40 presenting with cognitive decline. So,
what do you think
you
that's
know,
from?
diet, lifestyle. I mean, when I first came to the US, and it was probably the same for you, Claudia, I couldn't believe that you didn't need to get out of your car. You can drive through everything. Everything's a drive through. It's like you don't even and now 2025, you don't even have to leave your bed. all your needs can be met without getting out of bed.
Yeah.
And
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 people
I
walk
think,
around in their pajamas.
right,
They don't even
yeah,
get dressed.
exactly. So I think diet and nutrition is playing a massive role of it, and especially in the US because there's ingredients in foodstuffs here that are banned in Europe.
Yeah.
And there are people that I know here who cannot eat pastry and stuff like that here. But when they go to Europe, they can do it and they're not impacted by it. It doesn't affect them.
Yeah. I can't eat pizza here or the I don't eat the bread. I'll have sourdough if I do.
Right, right.
It
Yep.
makes me ill.
Yeah, yeah. So diet, nutrition, and lifestyle is playing a huge role, and of course chemicals. And we still don't know the impact of the COVID vaccine. I mean, what are the long-term impacts of the COVID vaccine?
Yeah.
So there's all those kind of things, and I think that all those combined are factors.
Yeah. So that yeah, and that will be interesting because they think it's affecting children as well, the
Mhm.
COVID vaccine,
Right?
because
Yeah,
they soon had the children taking it all through fear.
yeah, you're right, exactly. And look at the increase in the rates of autism now, prevalence rates of autism. It's changed dramatically.
Yes, it's a
Right.
lot. Well, and this is interesting. So, Chase Hughes, he said that they, because as I say, he's very into the neuroscience,
Mm.
and he said that if you get a nicotine patch, the lowest dose, halve it, cut the little plaster, and obviously you've got to check the child isn't allergic to plasters, and then put it on a child with autism, it will reduce it by like 70-80%.
Amazing, isn't it? Incredible, this stuff.
So it's like, so I wonder then if actually that could be the nicotinamide,
Mm-hmm.
that might be a safer option than that. But it's like, I mean, obviously, again, I can't prescribe, but I could always, well, you could try this if you wanted.
Yeah, it's a recommendation, isn't it? It's a
Yeah,
recommendation.
well, it's just like drinking water, or
Right.
turmeric or coconut oil or whatever. But it's
Absolutely. Exactly.
so yeah. But it is very interesting. I think having a a good belly laugh, though, is one of the most important things that we can do to engage people in life. And because everybody does remember that, because we know that again, it's the physiology of putting a
Yeah.
smile on our faces. And I don't think there's not many people know here, but you are actually a comedian.
Yeah. That's right. Yeah, I certainly am. Stand-up comedian. Yeah.
So tell us, and I know because you used to do it was like the way the red nose, you'd go into places. Do you still do all that?
I haven't had time to go into memory care communities of late to do it, but yes, I do. And I use it in my practice. I will get my red nose and pop it on if somebody's upset and crying, and it turns it around. Um, yeah, I was fortunate enough a number of years ago to be trained in the use of clowning and comedy in healing by Patch Adams, who many people will know about the movie Patch with Robin Williams. And so I was trained by him to use comedy and clowning in healing, and it's so effective. And as a stand-up comedian, when you are in a comedy club and you stand up there and do comedy, you've got all these people for an hour or so who leave all their troubles behind and they can't think about anything else other than laughing. And
Yeah,
of course, when you're laughing, that, like you said, a good belly laugh, you're releasing all these happy chemicals, and it's making you feel so good and so so cool and so happy that when you leave, if you've got a few problems, when you leave a comedy club or a comedy show, you're usually in a better position to like deal with them and handle them in a more positive way. So comedy has a massive, massive role to play in life, and especially today because life is stressful for people. There's a
Mm.
lot of stress out there. There's a lot of pressure on people, and so to be able to escape into a world of silliness just for an hour or so is really impactful for
It's just
them.
good for the soul.
Oh, absolutely. And I would always recommend to somebody's husband or wife, mother, father, son, daughter, that is supporting somebody 24/7 to get outside and go and watch a comedy show or turn on a comedy show on TV, and get some laughter and get some escapism, because we have to, I work with the families as well as the
Mm.
person living with dementia, and I'm always trying to get people to avoid burnout, because once people get to that burnout stage,
Mm-hmm. Mm.
everybody's in trouble. So avoiding burnout is absolutely crucial for people who are on that journey,
With
um,
them.
with
Yeah.
them.
And
Yeah,
because you're right, because it can lead to anger, frustration, resentment. It's the roller coaster of emotions.
absolutely. Yeah,
And as we've said before, I've done this many times with the group. The tone of voice might not be, it's not what you say, but it's the, oh God, do you want a cup of tea?
yeah, yeah.
Instead of hey, shall I put the kettle on?
Right. Yeah.
Saying it with joy as opposed to like
Right.
it's such a burden. Even though
Yeah.
they probably do feel it is a burden, because it's Groundhog Day over and over and over again. And when will it
Right.
end? And there comes the guilt that they probably potentially wish they would just die.
Right. Yeah.
I mean,
Absolutely.
but you've got to say it. It's true.
Hmm. Yeah.
Um,
Yeah.
when will this ever be over? Is this my life? Because I thought it was going to be this way, and now it's this way.
Right.
So,
Yeah.
so
Yeah. And you've got different challenges as well. If you're younger and you develop a cognitive
yeah,
issue, you've got different challenges than what you have if you're 75, 80. Because most younger people are still working, they might be putting kids through college, they got financial commitments, they might have a mortgage, um, and then they're hit by dementia. Everything changes, everything turns around. So yeah, the more we can do to reduce our risks of developing cognitive decline, the better. That's, prevention is obviously better than cure, because we have no cure for the primary dementias.
yeah,
So doing the stuff that you do, doing the stuff that I do, doing the stuff that all the people that are working in dementia proactively are the beneficial things. And
yeah. Because of course
so
we don't see people who have, say further down the line of living with dementia. It's if they can get their diagnoses first of all, and then what I this is why I learnt havening, became a certified havening practitioner, because in my opinion it's really important for us to get rid of any traumas, if there are any, especially from sexual abuse,
right,
because as they go further down the line of, say, their dementia journey, and they're in a home, and if the caregivers there aren't very well taught, that then, and they may
yeah,
just pull, because on a rush on the time scale, they may just pull the covers down with and start washing somebody's bottom. Well, to be honest, if somebody just pulled my covers down and washed my bottom, I think I'd hit them.
right,
Yeah. So, but
absolutely,
and that if somebody has got PTSD or from a trauma like that, well, they will lash out.
yeah,
And then of course a big that they then put on psych meds, and then their journey is very
yeah,
rapid to
absolutely,
death.
yeah. It is important because most of us carry developmental trauma, trauma from childhood.
Mm.
We have it. We all have some kind of trauma during
Mhm.
our childhood, and
Mm.
absolutely right. And if you're working now with older people in their 80s, the trauma that they experienced as children would have been pretty horrific and never addressed, never dealt with, just pushed at the back of the mind. And,
Mm. Mm.
oh, you'll be all right. Pull your socks up. You'll be fine. That kind of attitude,
Yeah,
wasn't it, back then?
yeah, yeah.
And then people, I mean, predominantly people working in memory care communities, they're not trauma therapists. They have no training in that. They have no background or knowledge in that. So yeah, they don't think they're caregivers, and delivering personal care is what they're trained to do. And absolutely right. If somebody's been through that sexual abuse trauma that's never been resolved, and somebody does come and do intimate care to you, because it's not with you, it's normally to you, um, that trauma is going to surface, and
Yeah,
there's going to be some kind of response.
yeah.
And then
Because
it
I
is,
think their
nobody understands.
isn't their fight, flight, freeze thing a lot
Right. Yeah,
gets fired
absolutely.
more rapidly.
Right.
Um,
Absolutely. Yeah.
so they will just the jumpy, it's like that. It's like
Yeah.
who are you? Because they'll have forgotten you from the day before.
Right. And again, hypnotherapy can play a huge role in resolving that trauma, even if somebody is advanced in their neurocognitive decline. The use of hypnotherapy can still be beneficial in resolving that trauma. Because of
Yeah,
course, with hypnotherapy, you're bypassing the mechanical parts of the brain and you're working with the subconscious. So it's again, I make no apologies for saying that the power of hypnosis in everything in life is incredible and very powerful.
well, yeah, because it's a belief system.
Absolutely, yeah. And you don't, unlike EMDR or cognitive behavior therapy, you you don't have to relive the trauma. You don't have to be thinking about it. You put somebody into trance and delve into their subconscious and get rid of it without them having to really focus on the incident.
Yeah,
And
or just give them more resources.
right,
What
right,
would they what do they or superpowers? What do they need?
yeah, yeah, right,
While they're
right,
while they're there, what would you like to, how can you change that now?
yeah.
So it's so that it's different, or shrink it down
That's
small.
just a few moments ago. You mentioned purpose, and that absolutely crucial. I do some coaching now with people who are living with dementia and their husband, wife. And one of the things we focus on is making sure that one has a sense of purpose when you wake up in the morning.
Mm.
What is it? What's your sense of purpose today? It's going to change, maybe change throughout the day. But when you wake up, what is your sense of purpose today? Because, of course, with people living with dementia, at some point, motivation becomes a problem.
Mhm.
People don't want to do anything. They can't, they might not be able to self motivate. They might not be able to think about what am I going to do today. So having set your sense of purpose in the morning is crucial. And again, as I said, it might change throughout the day, but if you've got a sense of purpose, which, as you know, mine is always to turn a frown into a smile. That's what, I want to do that every day, constantly want to turn a frown into a smile, whether it's with people that I work with or whether it's with the animals on the ranch. If I can make them happy,
They'd
that's
be
my
going like,
sense of
your
purpose.
horses would be going like this to you.
That's right. Yeah, that's right.
And your
And
pig.
yeah, right. And as you know, Claudia, with horses and stuff, they they can tell you if they're unhappy.
Yeah, they don't
You
lie.
know if they're unhappy, and and they know if you're unhappy. because they'll come and snuggle up to you or nuzzle you or something, because they feel that empathy. They're very empathetic, aren't they, animals? So that's another thing for people living with dementia. The impact of being with an animal is massively positive, because the communication's different. You don't have to talk. You don't talk to a horse. A horse doesn't know what the hell you're talking about. It'll listen, and it's probably thinking, I don't know what he's saying, but it must be important. With animals, it's all about body language, isn't it? And communicating via body language, which you alluded to earlier, about, asking somebody if they want a cup of tea with enthusiasm and joy, and not, do you want a cup of tea? Working with animals there's no need to communicate verbally. So when somebody with dementia has got to a point where, not everybody does, but many get to a point where verbal communication is difficult, both receptive and expressive, being around an animal is totally different, because there's no verbal communication. It's contact. It's the hugging like you spoke about. It's just presence, the present. It always amazes me when somebody approaches a horse and goes straight to stroke their face. Why would you do that? Horses don't do that. Horses don't come up to you and stroke your face. It's alien to them, and it can be seen as threatening. If it's your horse and you know your horse and it knows you, that's fine to do that. But it always amazes me when somebody meets a horse for the first time and goes straight to stroke their face.
I think the safest thing is to give it some grass.
Well, to say that me, I just find the safest thing to do is just stand there. I just stand there and let the horse come and talk to you before you talk to it. But yeah, animals, cats, dogs. We've got everything here: cats, dogs, chickens, pigs, horses, and anything else that anybody wants me to adopt. I'll take it. You're
in Arizona, so you might have a few scorpions.
Spiders, scorpions,
snakes.
Yeah. One of my cats brought in a king snake into the kitchen. I went through the kitchen, went to the bathroom. Everything was okay. I came out of the kitchen and there's this big king snake sat there in the middle of the kitchen floor. I was like, hello? Well, you didn't get in, So the cat brought it in.
Oh my goodness.
It was alive. It was okay. I picked it up and put it back outside.
Yeah, I know.
Things we don't have to deal with in England, Claudia.
No.
Especially where we come from in the north.
I know. Oh, it's funny. So for the caregivers, again, because they're the ones that contact us. Okay. So what would you recommend for any marketing for people of how to get this out? I've suggested doing free talks, at places, and just letting people know that you exist and that you can help them. What about yourself?
I'm not the world's greatest marketer. The things that I focus on are sense of identity. So if your name is Elizabeth and your husband is David and you're the main person supporting David 24/7, maintain your sense of identity, because it's so easy to be seen as a caregiver and lose your role as a wife, a mother, a grandmother, a girlfriend, or whatever your role is. And the characteristics and the personality that make you have to keep hold of them. You got to remember that you're important too. So I think any marketing that's done through social media, and That's pretty much all I use, Facebook, Instagram, and TikTok. I talk about that. I talk about maintaining sense of identity. I talk about how important it is for you as the caregiver. Because as you said, it's usually the caregivers that come to you. So I want you to remember that you're not a caregiver, you're Elizabeth, you're David's wife. That's the first thing. So when you're using a marketing angle with people, with relatives and families, that's what I would focus on first and foremost, maintaining your sense of identity. How do you do that when 24/7 it's like Groundhog Day? So David is asking Elizabeth 10, 15, 20 times a day the same thing, the same question. How do you maintain your sanity when you're living that every single day? How do you maintain your sanity? Well, you have to remember who you are, and you have to maintain your sense of self, and also have your sense of purpose throughout the day.
Okay.
So, from a marketing angle, always focus on that first. And then, how do you prevent your risk of developing a neurocognitive disorder? How do you prevent or reduce your stress throughout the day? So we need to focus on managing your stress levels and your anxieties and your fears. Because there's loads in that journey of dementia, it's all about anxiety and fear from the person living with the neurocognitive decline and the people supporting them through that journey. Anxiety and fear. Those are the two things to manage and try and get rid of. You're never going to get rid of it totally, but if you can reduce it massively, that changes the mindset and it changes the way that the journey develops. And then education. And there's a lot of, depending on what state you live in the US, determines what level of support and resources and services are out there. So you've got to tap into them to make sure that you're utilizing them. But there is nobody better to support when it comes to a marketing aspect. There's nobody better to support that person than somebody who is working in the field of dementia at a level that we work at. You're trained, the benefits of hypnosis for everybody concerned. What kind of supplements people can be recommended. You know about the rule of 7. You know about the mind diet and all those kind of things. So I think a marketing angle for people who are supporting those living with dementia has to include all those things.
Yeah.
I don't know if that's any good as an answer to your question.
No, it is actually, because actually it's about going, where might these people be? And it's about actually, it's the hook to say, right. Are you still you?
Yeah.
You know, have you got lost in this journey? I can help you get you back. Absolutely. Let's get you again. Let's find you. And then as we help, your situation, this journey that you're on, then together, as you're looking after your loved one, you are actually by nature looking after yourself as well. So and then the hypnosis, I mean, I'm in the state of North Carolina, so I can't do hypnosis. I could do a guided visualization though. On some...
Okay.
Oh,
well, that's different.
So they might just happen to go into the hypnagogic phase. Oh, okay.
Yeah. They must be relaxed.
Oh, I was going to do some relaxation with you, that's all.
That's it. Exactly.
And actually, it is what they want. They actually do want to have that relaxation through their muscles. Yeah. Yes, if you're going in for a quick whatever, you can do a quicker form of hypnosis, look up and then bring it down to just change a certain symptom, if you like. But it's but I think people do want to feel relaxed so that they feel calm, because when you're calm, you're then clear-minded, and when you're clear-minded, you can handle any situation that comes your way in a lot more diffused way, instead of being so frazzled, so overwhelmed, so stressed, that it's just like, okay, this is shit, but you know, and I got to deal with it. Because actually sometimes that is what you're dealing with, real life shit. Literally. It's like, okay. And it's like it, but so many people just then they, I know it, I can imagine, you know, it's like, oh, but it's like, just get it all in the bathtub.
Yeah.
Do you know what I mean?
Yeah. See, many people tell me they don't know if they're doing the right thing. I don't know if this is the right thing to say. Is this the right thing to do? And when they say that to me, I always respond with, you are doing an amazing job.
That's
You're doing
nice.
great. You're doing fantastic. So whatever you are doing is right. We might need to change how you do it, but whatever you're doing is the right thing to do. So, and if that's how you can start your conversation, they, you see this immediate change in body language. You see this like, oh, somebody has told me that I'm doing it okay. I'm doing okay. And then they open up for you to give them the additional
That's really
resources.
nice. That's really nice, Dan.
Yeah.
Because you're right. People just want to know that they're not shit, you know, because otherwise, because the guilt that they would be feeling so much of every day, you know, it's like, you know, and the shame of just having to go through this and not feeling that they're good, they're not good enough, because that can be triggered from childhood. Not good enough. You're not good enough, and here I am again, I'm not good enough. So that is probably where they might go to if they are like that.
The other thing as well to remind people is that you already have the skills. You know, you've been through stressful situations throughout your life. You've experienced loss. You've experienced gain. You've experienced love. You've experienced all these roller coaster of emotions that we go through all the time. And, you know, life is all about evolving from the day we're born up until the day we check out. It's all about evolution, isn't it? We evolve and we change and we adapt. I mean, the human being is fantastic at adapting. That's why we became who we became, human beings. So people already have all those skills. So if you can hone them into how did you deal with this situation when you were 22, for example? So let's tap into that same process that you used. What were your problem solving skills? Because, you know, at our age, we've all got huge problem solving skills. We've all been through stuff, stressful stuff, great stuff, fantastic things have happened to us, not so good things have happened to us, and we're still here. Why? Why are we still here? Because we adapt. And again, COVID, massive demonstration of how we can adapt to a situation. So, yeah, people have got the skills, they've got the knowledge, they've got the experience. It's just the competence and the confidence to tap into those things that I guess people have forgotten about. Because, you know, if this happened when I was 22 and now I'm 61, forgotten all about that. But yeah, wow, how did I get through that? This is what I did. Okay, so let's try that. Let's see if that is
and you
something.
can do that in the hypnosis as well.
Right.
Go back to a time where there was and how you managed it, and bring back that resilience, that determination, or that inner glow, or whatever it is. Or if they are depressed, go back to a funny time in your life and really immerse yourself in it as though it's happening right now, and get some laughter going, and you can bring that funny feeling back with you.
So guided visual imagery
Laughing your head
with
off.
age regression is perfect.
There you go. Well, because we, you know, if I said to you, it's true, because we all age regress. What was the very first car you had? What was your very first car?
My very first car was a Ford Escort, one of the old types of
Yeah.
Ford
What color
Escort.
was it? Yeah.
It was red.
Yeah. There you go. So you've gone back. That's
Yeah,
age regression.
absolutely. Exactly. Yeah.
So so it's like, what do you mean? I
Yeah.
can't do that.
Yeah.
So
Exactly. There you go.
so
Yeah.
yeah, you can go back to a good fun
Yeah.
and anchor them in. Actually, that's why I do
Mhm.
that with the bunny talk. There's
Right.
loads of stuff within the bunny talk with all this that I can use. So no,
Yeah.
I love it. It's really good. So I have recommended your book for everybody to read because it's so helpful. And then of course you did another one on dental health. Um,
Oh, my God, that is so crucial. Jesus. Yeah.
Go for
Dental
it.
health.
Mention a bit about that.
When people with dementia get to a certain point in their journey, and it's you are now responsible for their oral hygiene and dental care, and they are resistive because for various reasons. One, I don't need you to help me, I can do it myself, but they can't and they don't. Um, Talking about trauma, past trauma with dental hygiene and dentists and parents and that kind of stuff can kick in. So it can be very difficult for people to maintain their own oral hygiene. So you've got to take responsibility for it. And there's a massive connection, there's a correlation between developing Alzheimer's disease and tooth loss. So if you've got missing teeth, there's a massive risk that again is another risk factor for developing Alzheimer's disease. And tooth decay and all that kind of stuff that goes on in the mouth. Absolutely crucial to help. So the book about dental health is a workbook kind of thing. It's a guide. There are examples and suggestions of how you can do this and how you can work with people with dementia in maintaining their oral hygiene and dental health. And one of the things that is absolutely crucial is that every time somebody takes medication, which is usually filled with sugar to make it taste pleasant, their teeth and their mouth needs to be cleaned because all that sugary stuff just sits there. And we know what that does to your teeth. So we've got to make sure that every time somebody takes medication, wash their mouth, brush the teeth, use mouth rinse, whatever it is, however you can do it, do it. End of life care, palliative care, that is the worst time that I see mouth infections, oral disease, and all that kind of stuff, because it becomes something that people don't think about.
Right. Yeah.
So maintaining a clean mouth again is so important. And aspiration pneumonia is the biggest killer of older people.
Right. Yeah.
And aspiration pneumonia is usually caused by stuff that's in the mouth, in the teeth, then gets down into the lung and finishes people off. And you can avoid it. You can reduce that risk massively by maintaining good oral hygiene.
Wow.
So yeah, the book,
I know.
what is it called? They're all available on Amazon.
I know.
Pocket Guide to Mouth.
I've got it. Here it is.
Oh, there you go. Yeah, Pocket Guide to Mouth and Dental Hygiene in Dementia Care. Absolute crucial tool to have in your weaponry.
There you go.
Absolutely. Very
I'll take
useful,
a picture of
practical.
it as well, actually, and I'll put it so that you can see it. Yeah. No, I've yeah, I read that. It's I know.
Yeah.
So thank you for doing all of those. Thank you for writing them. Are you got anything else coming out soon?
No, not yet. I'll let you know.
Okay. All right. So, so thank you. I really appreciate you coming on here, giving us your expertise. And as I say, this whole course was born from you. And
Oh,
you know,
good.
I have I always obviously
I'm
give
a daddy again.
you have lots of babies.
Lots of babies.
Oh, so funny. So,
Mm,
and you know, I've had a couple of MDs on here and some other people. It's been quite enlightening. You know, there's
good.
one that works in hospice and stuff. So it's really helpful. The whole because I speak on this in the conferences, and it's people are interested. You know, they want to know, and I'm doing that diagram with the fear and the going back to rementia, you know,
Remention. Yeah.
dementia, yeah, get from Tom Kitwood.
Yeah.
So it's so yes, and I think it's crucial that people in our community have some understanding about this,
Yes,
because we're seeing
absolutely.
clients in the sandwich generation, you know, that those are basically our clients
Yeah.
usually, you know,
Yeah.
middle-aged women my age who might still have children, because so many
Mm,
people having children later on might still have teenagers children, and then
right.
they've got parents who are going, who are having to move to live near them, and they've got this going on. I have so many like that, so many. And it's really important to be able to have something to say, you could do this, and they go,
Yeah.
thank you, you know?
Yeah. And I think that's the message to leave with people today is that there is so much more we know and so much more we can do, for people living with a neurocognitive decline and to reduce our risks of developing it as we age. So, and then it's down to us, isn't it? It's, every individual has a responsibility to maintain their own health. So it's down to you. We can give you the tools, we can tell you best way to do it, can advise you, suggest, and then it's down to you. So, we can lead the horse to the water.
Yes, yes, but you
So,
can't make it drink.
but it's an exciting time it's an exciting time, 2025 in the world of neurology, in all neurology, in everything that's happening in neurology is amazing. And, the use of AI is something that neurology uses so much. So
Yeah, yeah.
yeah, it's a good time.
I know it is exciting,
Yeah,
you know, we all keep on learning, and so it'll be, yeah, watch this space, see what happens.
exactly.
You know,
Absolutely. That's
so
it.
it's
Yeah.
good, it's good. Okay, well, I'm going to stop the recording there. So thank you, Dr. Dan.
Thank you for inviting me. It's been a pleasure.
Yeah, no, thank you.